The last question that came to my mind right now is there's a getting worse or feeling of getting worse before they get better. I noticed that with whether it's Atlas orthogonal or even CBP type of maneuvers. And the question is how does a patient handle those moments? Like if they go once, if I go once to you and I feel like I'm getting corrective, and I'm like, oh my God, Brian, I have head pressure, I have this, and I'm feeling worse.
Yes, great question. And that's one of those reasons why I'm very reluctant to take on a patient that says, can I just dabble with your plan? Because even if we give a very, very careful, curated plan that has almost no chance of doing any harm to you, you still could feel a little bit worse the first time you try it, the second time you try it. And so if you have the people that just want to dabble, that's going to be dangerous for you because you may go to the right person for you and you may not start getting results until you've worked on that plan for a period of time. So now that period of time should happen pretty quickly. If it's regenerative treatments, it should be within the first 3 treatments. Absolutely. I've only seen 1 or 2 times that it's taken longer to that out of 1,000 patients where they needed more than 3 to start seeing return. But sometimes you're not doing the right therapy because you might need to work on the curve first. But definitely go, when you have consulted with somebody like Robert, you talk to all the doctors, and you're sure what plan you're going to start, you have to go all in. Because if you're only going to dabble, you might just, have you ever seen those diagrams, Robert, where they're digging, they're like memes, and somebody's only like 2 more shovels full to get to like their golden prize, and then they stop because they get frustrated? You have to give these folks a little bit of time in order to see the results. And there are miracle cases where 1 visit and somebody's cured, but it's more often that somebody's had to work on this for a few weeks or even up to a month before they really start to get the benefit.
So hopefully the noise ain't too loud, but I wanted to ask one more question.
Yep.
Do you send patients out to any other type of conservative treatments? For example, I started to go to see a functional neurologist who was looking at my visual convergence and
yes.
VOR, and he said, you pass what everyone fails and you fail what everyone passes. So, and I noticed that, which is why I don't particularly drive too much, because the information overload, something's going wrong. So is that something maybe within your care plan to resolve itself? Or do you ever feel the need for going external?
It's a great question. One of my colleagues and I spoke about this about a week and a half ago. And he does the Carrick Institute, chiropractic neurology. And it's interesting because in that institute, they believe that it's everything that's wrong up in the brain that causes the problems lower. But if you think about it, if at your cervical cranial junction, you have an abnormal amount of blood going in and out, you have direct pressure on one of your most important nerves, or your cerebral spinal fluid is stagnated, you have intracranial hypertension because of a structural deficit, it just seems hard for me to believe that if you only fix the way that the brain is, that you're going to fix the blood flow in and out of the head, the spinal cord tension you're going to eliminate. And so I feel like if you know for sure that there's a structural problem that's impeding flow in and out of the head, that you have to treat that first. And you can treat it concurrently with some neurology things, some visual exercises, and you can have that going concurrently, just like you should be with curve correction. You can also make sure your oxygen's high, you're eating super healthy, you can do some neurology. But if you're not improving the connection between the brain and the body, and that's the primary lesion, then you're never going to fully get it to resolve in my chiropractic,
it makes a lot of sense. You can't just try to map the brain. Anything that's brain mediated, you're only gonna try to correct that neurological flow through an abnormal structure. So it just doesn't make sense.
Exactly.
Yeah. So
okay.
Listen, I think I ran out of questions. I probably have 1,000 more, especially when it comes to imaging, because that's my love, radiology. So I want to thank you for taking your time to meet with us. You're my first video, and I think everyone's going to learn a nice lesson here that we have to be careful. Us in the CCI community, from 2018, I went bedbound, and I actually stuck to that routine. And I was that one of those 22 hours a day laying down, up and down. And I decided, no, I'm not going to allow this to happen, because I know a body in motion stays in motion and the opposite's true. And so I would not be sitting here if it wasn't for a good chiropractic care and a good regenerative medicine doctor. I would not be where I am. So Dr. Hutcheson, thank you so much for taking part of your vacation time to meet with us and be able to help the community and spread this knowledge about upper cervical care.
It's been a pleasure, Robert. Thank you so much.
Thank you.